name is Dr. John Erickson. I'm going to share with you some vital information about your thyroid and a condition called Hashimoto's. Now, if it does look like I'm reading some information, I probably am. I want to make sure that I get this information correct and accurate as I get it out to you. Now, understand, I'm not a medical doctor. I'm a doctor of chiropractic. And now, chiropractic is the leading form of alternative healthcare out there right now. So what you're going to get in this short little video presentation is an alternative view on thyroid problems, specifically Hashimoto's. Now, the topic of thyroid problems is a sensitive one for me. I know how frustrating, how aggravating, how depressing, and how tiring dealing with thyroid problems can be. You see, I have 3 members of my family who have been diagnosed with this condition. Now, if you're okay with taking medications for your thyroid condition, or you're content with the traditional medical approach for the thyroid problem that you may be dealing with, then this short video may not be for you. However, if the medications aren't working, and if you are tired of swallowing vitamin after vitamin and still have questions that haven't been answered about your thyroid, and you're wondering if there is a better way, then I'm glad that you're here today. Our thyroid disorder population is grossly underserved in both the conventional and alternative healthcare system in the United States today. Conventional approaches are all based on measuring the TSH, or thyroid stimulating hormone levels, and providing synthetic hormones if it is abnormal. Now, once the TSH is brought down to normal, the job in the conventional healthcare system is done. End of story. The question of asking why the patient has become hypothyroid is rarely asked. Furthermore, the question of why the patient may have persisting thyroid symptoms after normalizing the TSH is also rarely asked. And this leads to millions of thyroid sufferers who continue to suffer. The alternative approach is fixated on treating the thyroid as a single nutrient deficiency problem, laying the cause of thyroid problems to such things as iodine deficiency or tyrosine deficiency or a heavy metal toxicity. Due to the interrelationship of the thyroid with other critical areas of the body, a more comprehensive assessment and treatment approach is needed, and searching for that one nutrient that will fix things only leads to rotator cuff tears from holding all of the supplements that you get to carry around. One of the major problems we have is that people are trying to treat thyroid problems without understanding the complexities of thyroid function. Not understanding how the thyroid works can lead to procedures that are unnecessary, costly, and can actually make the condition worse. The thyroid gland influences all other cells in the body. This means that thyroid problems can influence the heart, leading to tachycardia or a racing heart. It can influence the brain, leading to brain fog or difficulty focusing. It can influence bone growth, leading to osteoporosis. It can influence digestion, causing acid reflux, constipation, or poor nutritional use. It can influence every cell in the body. This alone makes the thyroid problem a serious, life-altering condition. But consider for a moment that in many instances, the thyroid problems are simply indicating that there is a more serious problem occurring in the background. Many alternative healthcare providers do not conduct laboratory testing. They use unreliable testing procedures such as axillary temperature retesting or iodine skin absorption, etc. It's time for a critical look at how the thyroid is being managed and why most current approaches do not work, meaning that these approaches do not address the true nature of the problem so that the symptoms can be addressed appropriately. There are 7 different pathways that can lead to what appears to be a low or a hypothyroid on blood work. The purpose of this video is not to go into detail on each of these 7 different pathways. That's already been done before. But for your information, only one of the 7 pathways is a true thyroid problem and can be addressed with medication. The other 6 are not true thyroid problems. And the one that we're going to discuss today is a serious condition that in and of itself can negatively impact your thyroid, causing the symptoms that you may be dealing with. Worldwide, the #1 cause of thyroid hypofunction is iodine deficiency. But in the United States, the #1 cause of hypothyroidism is Hashimoto's autoimmune thyroid. Now, an autoimmune condition is one where the immune system has mistakenly begun to attack the body's own tissue. And left unchecked, the immune system may eventually destroy the tissue or the gland. Hashimoto's is an autoimmune attack against thyroid cells. The immune system is attacking the thyroid. It may present as a hyperfunction, meaning it's functioning at too high of a level, or it may present and can lead to a hypofunction. In most cases of Hashimoto's, there is a slow, gradual attack against the thyroid, eventually leading to loss of enough thyroid cells that the condition presents itself as a primary hypothyroid problem. This would show up as elevated TSH on your blood work. Now, when the thyroid does not work adequately, the pituitary, an area of your brain, increases the production of TSH in an attempt to increase thyroid gland activity. Now, most people who have Hashimoto's never actually develop an overactive thyroid symptom. Over time, they start to develop the symptoms of low thyroid function. They have their TSH measured, and the TSH is usually found to be elevated, and they are typically diagnosed as primarily hypothyroid and placed on thyroid hormone replacement. The issue of their autoimmune attack is not addressed. Instead, they're considered managed by having normalized the TSH from thyroid hormone replacement. So in a sense, patients are having their TSH managed, and not the underlying mechanism of their thyroid loss. In most of these cases, since the autoimmune response is ignored, over time they lose more and more thyroid cells, and their requirements for thyroid hormone placement continue to rise. Even more important, most individuals with Hashimoto's will develop hypothyroidism despite the fact that their TSH is managed with replacement, and they still continue to have all of the symptoms of thyroid hypofunction. Researchers conclude that the presence of TPO antibodies in the blood are indeed a marker for Hashimoto's and also a marker for future thyroid failure. So what are the symptoms that you may be experiencing with a thyroid problem? Well, that can depend on whether you have a hypothyroid or a hyperthyroid problem. Let's go over some of the thyroid symptoms. Do a mental review as I go over these with you and see how many of these symptoms you are struggling with now. Let's start with the symptoms of hypothyroidism, or a thyroid that's not working hard enough. Number 1, fatigue, tired, sluggish. Number 2, cold feet or hands. Number 3, do you require excessive amounts of sleep to function? Number 4, do you gain weight easily? Number 5, do you have difficult or infrequent bowel movements? Number 6, are you depressed? Do you suffer from depression? Number 7, do you lack motivation? Number 8, do you suffer from morning headaches that wear off as the day progresses? Number 9, do you suffer from thinning hair or excessive hair falling out? Number 10, do you suffer from dryness of the skin and or scalp? Number 11, do you suffer from mental sluggishness? Those are symptoms of hypothyroid. Let's go over symptoms of hyperthyroid, or a thyroid that's working too hard, too fast. Number 1, do you suffer from heart palpitations? Do you suffer from inward trembling? Do you have an increased pulse even at rest? Are you nervous and emotional? Do you suffer from insomnia? Do you suffer from night sweats? And do you have difficulty gaining weight? Those are hyperthyroid. Now, the symptoms of Hashimoto's autoimmune thyroid will show up as a mixture of both hypo and hyperthyroid. You may have some or all of these. Now, for many, Hashimoto's is not taken seriously enough by the individual and the healthcare practitioner. Rarely is this condition handled as a Hashimoto's problem, which is, incidentally, operating by a different set of rules by that of a thyroid problem. Often what is recommended to treat the thyroid in Hashimoto's situation is the same thing that would be used to treat the thyroid in a regular conventional thyroid problem. This, unfortunately, can sometimes make things worse. For example, iodine therapy is contraindicated in the management and treatment of Hashimoto's, yet you will hear of alternative and traditional healthcare providers recommending iodine therapy when it has been documented that this can make a Hashimoto's condition worse. I want you to understand that Hashimoto's is what it is and how it can ruin your life, and also how for the majority of thyroid sufferers, Hashimoto's may not be being managed efficiently. In the case of a person with Hashimoto's, the problem is not with the thyroid. The thyroid is the innocent victim of multiple drive-by shootings. Hashimoto's is an autoimmune problem. Now, autoimmune means that the system is now targeting the thyroid for destruction. The thyroid is being killed slowly, sometimes rapidly, as a result of an overactive immune response. The disheartening reality with autoimmune conditions is that if you have one, you significantly increase your chance of acquiring others. If the immune system will mistakenly target itself in one area of the body, it can and will do it in others. Other autoimmune conditions can result from immune targeting Other body tissues are rheumatoid arthritis, where the immune system is targeting the joints, celiac disease, where it's targeting the digestive tract, scleroderma, where it's targeting the connective tissue, lupus, as well as brain. The immune system can target and attack your brain, causing memory and balance problems, and also your hormones, causing hormonal imbalances, hot flashes, infertility, etc. It is precisely for this reason that a thyroid problem is bad. But Hashimoto's, we could say, is even worse. And if it's not managed appropriately, it can lead to further debilitating and complicating factors. Lab work can be utilized to determine if your body is producing antibodies and attacking your thyroid gland. Unfortunately, the standard medical protocol for treating the thyroid is hormone replacement therapy regardless of what is causing the thyroid problem. This means that the majority of Hashimoto sufferers have either never had the right testing and have been put on thyroid medication, or they have had the testing but they are still placed on thyroid medication. So riddle me this. If the thyroid is not the problem, yet your only approach is to treat the thyroid, what hope have you of ever finding relief? Understand that the management of Hashimoto's is very different than simply managing a thyroid condition. Conventional approaches are through narrow thyroid lab work followed by the use of medication. Typical thyroid lab work includes the TSH, which stands for thyroid stimulating hormone, and maybe T4 and perhaps T3. Both of those are thyroid hormones. This is not enough to thoroughly evaluate the thyroid, and this is definitely not enough to determine if there is an autoimmune problem. Thyroid hormone replacement may give you a honeymoon period or some temporary relief of symptoms, but due to the autoimmune attack on the thyroid, more and more thyroid tissue will be destroyed over time. This will lead to fluctuating TSH levels and the constant adjusting of the thyroid medication and the eventual return of your thyroid symptoms. There is a growing number of people who are autoimmune and being treated with hormone replacement, and they're developing sensitivity reactions to the actual hormone medications. This, obviously, is not good. Alternative approaches are through the use of vitamins, tyrosine supplementation, and iodine supplementation. Hashimoto's is not a thyroid problem, and taking thyroid glandular supplements or lots and lots of vitamins is not addressing the cause. Important item here. Again, iodine supplementation contraindicated in a Hashimoto's case, as it can flare up the autoimmune response. So this is why you're actually not getting the results you're seeking, and this is why you will continue to get worse symptomatically as well as functionally. Improper management of Hashimoto's condition will allow the immune system to continue its assault on the thyroid gland and eventually other tissues. Remember how the thyroid gland influences every other body tissue? Okay. Unchecked, this condition will lead to more and more progressive signs of brain and body symptoms and signs. If the immune system assault on the thyroid is not handled, the thyroid tissue gland will become more and more damaged with the passing of time. And the bottom line is that the cause of the thyroid problem needs to be properly evaluated and then worked on. Unfortunately, the longer people have these conditions, the more the condition can become a part of them. Don't let this happen to you. Don't give up in your battle with your health. If you are frustrated now, it is probably because you don't have all of the information that you need to make the choices that you need to make. I have a sister with Hashimoto's. My wife has Hashimoto's. My father is suffering from a thyroid problem. I've invested a lot to find out what it takes to help people who have Hashimoto's and thyroid problems. I have learned that only in finding and addressing the cause of chronic health problems can the hope of healing truly be found. I treat people, not their diagnosis. My recovery program is all about identifying what is not working correctly in your body and then addressing the cause of that as opposed to simply chasing your symptoms around. Let me help you find the answers and the results that you so desperately seek. Don't wait any longer. Contact my office for a special introductory offer. This one call could change everything. Don't wait. Call today. Let me see what I can do to help you reach and restore your health. Have a great day.